Hi everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about how painful is knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our videos related to knee replacement surgery. So this is a common question I get online or from patients prior to surgery is how painful is it? Well, the surgery itself isn't going to be painful because you're going to be under anesthesia and probably sedated for most folks. But really what we're talking about is after the surgery, what is the pain level like? What should I expect? So the simple answer is everyone is going to be different, obviously. Everyone experiences pain differently. Everyone has different factors that play a part in how you experience pain and the intensity and the type of pain you're feeling. So just keep that in mind as we talk about these things. But just to give you some idea, so initially early on, probably those first couple of days to first week or two, the pain is going to be the most intense, most commonly. And I would think of this as a moderate to a high intensity pain. So if you think about a 0 to 10 scale, you're thinking about at least 5 out of 10, sometimes maybe up to even 8 or 9 out of 10. 10 out of 10, that we think about as, we have to call an ambulance, your pain is so incredibly intense and unbearable. Hopefully you don't get to that point, but it's definitely not uncommon, definitely the nature of the beast to have that high intensity pain after surgery. We'll talk about as we go on in the video, ways that we can manage that pain effectively and stay on top of that pain. What are some of the characteristics of the pain that you experience? So how would people describe it? You may hear it as an ache or a deep achy pain, a swelling type of pain, tightness or a tight band around your knee or a stiffness of your knee. People might describe it as sharp pain. This is especially common when you're doing different exercises. You're starting to really bend and straighten that knee more, or when you're walking and standing on it more. And also there's some nerve pain that's possible, pins and needles sensation, things like that. For perspective, typically people say that a hip replacement is less painful than knee replacement surgery. I've even had patients who equate knee replacement surgery, the pain afterwards, to the pain of childbirth. Some have said that it's more painful. Obviously, I'm not one to speak on that. But just to give you an idea, it's definitely nature of the beast to have intense pain. Now, there's many factors that play a role in the pain that you experience and the intensity of that pain. Part of it is what were your pain levels before surgery? How long were you dealing with that pain? What was your level of mobility in terms of the knee joint itself and your personal mobility and ability to function and get around? What are your medical comorbidities? Are you someone with diabetes? Are you someone with a history of back pain and sciatica? Are you obese? Do you have cardiovascular or pulmonary comorbidities? These things can definitely impact how you experience and manage pain. What you want to think about is after surgery, all the structures of your knee joint are healing and recovering. The bone is healing, the soft tissue, the muscles, the tendons, the ligaments, everything is healing and recovering. The incision, and there's going to be inflammation, there's going to be swelling. Inflammation is a normal part of the healing process for tissues of your body. So it's not something that, something bad is happening if you have pain. It can be just a part of the normal process. Now, the good news is there's a lot we can do to manage your pain effectively. And the big key word is multimodal pain management, using many different modes, many different things to together manage your pain and stay on top of your pain after surgery. So this includes pain medicine, prescription pain medicine. It includes anti-inflammatories. It includes non-pharmacological means, icing, elevating, massage, compression, using light stretching and exercises, using mindfulness strategies. All of these things can be used together to help manage your pain effectively. And there's really no one size fits all. Some people may find a combination of these things that is effective. Some people might have a completely different combination of things. They might have certain things that they don't do and certain things that they do that are different person to person, patient to patient. But the goal is using all of these modes together for a more comprehensive management of your pain and ability to stay on top of it. And really that's the important thing, especially early on after surgery, is to stay on top of the pain. And you might have heard this before. Taking pain medicine, 15, 30 minutes prior to your physical therapy or prior to doing your exercises so that you can tolerate it. The more that you're able to reduce your pain and stay on top of it and keep it in a tolerable level, the more you're going to be able to tolerate your physical therapy, your exercises, walking, any activity, and the sooner you're going to see that recovery and return to your prior levels of function and mobility. So really important to stay on top of that pain. For most people, the pain is, again, worse early on. Lots of inflammation, lots of swelling going on. As the weeks go by, that pain is going to reduce. Those episodes of sharp, intense pain will hopefully start to reduce. The pain and difficulty with sleeping will hopefully reduce. And all of these things will just kind of slowly improve over time. Time is a very valuable healer in this situation and in most situations. And so with time and with doing your exercises and staying on top of your pain, the majority of folks will see improvements slowly. Some people this may take up to 6 months. Some people it may take even more than that, up to a year, year and a half, or maybe even a little bit more. The key thing to keep in mind is it's not uncommon to have some lingering pain, some lingering symptoms over those months after surgery. Your body is still slowly healing and recovering. But, for most folks, again, unfortunately not all, but for most folks, that pain will slowly get better and better till you're at a very comfortable and very manageable level. And for some lucky people with, no pain or symptoms at all. But it is not uncommon to still have some lingering symptoms and discomfort with things. So the big thing is, have a realistic expectations. There is going to be pain. It's going to be intense, significant, but there's lots of ways that we can manage that pain and stay on top of that pain. And with time and with consistency, that pain and those symptoms will improve and get better. And for the majority of people, you'll be happy that you had a knee replacement surgery in the long term. You'll notice improved strength, improved mobility, improved activity tolerance, and overall it will be a positive outcome. You just have to kind of get through the struggles of the rehab and recovery process. I hope you found this video helpful and insightful. Please be sure to hit that like button if you did. Please be sure to leave your comments or questions below. As always, and again, please be sure to hit that subscribe button so you can catch all of our latest videos. Thank you for watching.